Hi, I'm David Ortega, Director of Parent Services and Communications, and we're very happy to have our second Facebook Live for the semester. And we have Anna Harte, Dr. Anna Harte with us. She's the Medical Director at the University Health Services, frequently known as the Tang Center. So without further delay, Anna Harte.
Hello, so my name is Dr. Anna Harte. I am the Medical Director at Tang. I'm also currently the Interim Assistant Vice Chancellor. And I wanted to tell you a few things about the Tang Center that people have been curious about in the past, and then we have some time for questions. So first about me, my father was a fellow at Cal in the 60s and then worked summer session here during my whole childhood. So I was a faculty brat growing up on campus. I did the summer music program when I was a kid. I used to bring donuts and orange juice in to my father during his lectures. And then finally, I ended up going off to college at UC Santa Cruz, because that's where my boyfriend was, and studied music, and then went to Yale Medical School for medicine, and then finally to UC San Francisco. And I'm trained in internal medicine, primary care internal medicine. I worked a bunch of places in the East Bay, but eventually figured out that student health was the place I wanted to be. And I'm really excited to tell you about it. So a couple of things. First of all registered students can use the Tang Center. That's the most important piece of information I like to tell parents and incoming students. Some of them may be on our insurance plan, but actually our core services are funded, and for primary care and urgent care and counseling, all students have equal access for a very small copay. However, we have a lot else going on at the Tang Center. We have full services, university health services. We actually take care of faculty and staff a little in addition to students. But our student services include primary care, urgent care, as well as a number of different mental health disciplines: psychology, psychiatry, social work, behavioral health providers, and in addition, specialties, allergy travel services, and then our own little internal national health system, I call it, with lab and pharmacy and radiology, physical therapy, and more. So we have a lot going on. We have about 300 employees there. We had 126,000 visits last year. We are very, very busy. All of our providers are fully licensed and board certified. We are held to extremely high standards through AAAHC. It's called the Ambulatory Association for Ambulatory Healthcare nationally. We're fully accredited and we're completely dedicated to college health. That's why we're there. We frankly could make a lot more money if we worked in the private sector, and we're there because we really care about the students. We take care of students who are first generation, we take care of students with families, and we try to help them learn to navigate the healthcare system and also to meet their healthcare needs. So, how do we actually access care at the Tang Center? And how does it work anyway if they don't have our insurance? Well, all incoming students, undergrads and grads, are assigned a primary care provider within our primary care clinics automatically. All students have access to our online eTang portal, where they can access a lot of services without ever coming in. For example, they can send us secure messages, which is like an email that is fully encrypted and protected, to get advice. They can order prescriptions. They can order a bunch of self-directed tests, like sexually transmitted disease testing, like TB testing, vaccination titers. They can do pregnancy testing and all of that before even coming in. They can obviously call us as well. They can make appointments online. We're open 7 days a week. So we really try to be there for them wherever they might need us, whenever they might need us. In addition, we have after-hours access covered by a number of different advice lines, and our urgent care clinic is actually open most of the weekend. We do work predominantly on a same-day access model, which means that students generally can get in within 24 hours of wanting to be seen. And the biggest piece of advice I give students who want to come in is to make sure that they go online either the night before they want to come in or early in the morning. So if you have a night owl student who's up till 3 in the morning, they should go and make an appointment right then. If they are someone who gets up early to exercise at the gym, perfect. That's when they should go online. And if they can't figure that out, they just give us a call or they walk in. So student health, I've experienced over the years, and I've been now at the Tang Center for 18 years, that people think that student health is all, sex, sprained ankles, sore throats, minor concerns. In fact, there are quite a few significant serious diseases that we take care of. We are very, very happy to and prepared to take care of people with chronic medical conditions. The biggest thing that can help those students connect is to have them or you reach out to us early. So even during the summer before students come, if you reach out, we will be able to connect with them and make sure they are established with a provider. We can set them up and work closely with our insurance case coordinator and our care managers to make sure they get the services that they need. So again, whether they have our insurance or not, we strongly recommend kids with chronic medical condition, we connect with them early. Another thing that comes up a lot is mental health. There are a huge amount of mental health needs on campus here at Berkeley and nationally, and it's just rising. And we spend a lot of our time figuring out how to best meet those needs and also how to build resilience and support those students so they may not need to come in at all. We haven't gotten there yet, we're still working on that. But in the meantime, we have a number of different services offered locally at the Tang Center. We also have now 12 satellite centers all over campus that provide counseling so that students who either aren't comfortable coming into our center or it's much more convenient for them to come in locally, have a lot of other options as well. We operate on a brief model at the Tang Center, which means we really are trying to prioritize having access to all students, which means we can't hold on to students for a long time. So usually students have a couple of sessions. If they need more, then we work on connecting them with an outside community provider, all of whom are vetted by us as well. We have over 60 counselors, and we see, I'd say about 20 to 30% of them each year in terms of mental health needs. We also have a number of other more convenient drop-in sessions where they can come in just for quick advice. And now within our medical services, we're also screening for mental health concerns and able to briefly connect with students right there in the moment, even if they just want 10 minutes of advice on, for example, managing stress or sleep habits or something else that really makes a difference to their lives and takes care of their health. So other than that, we have psychiatry in-house. We do manage students with complex mental health disorders as well. And we partner very closely with other campus colleagues, both for prevention efforts through our health coaching and health education department, and also, again, with faculty and staff around students who are really struggling on campus, with students of concern and other committees and organizations. Okay, so students of concern on campus. I had a question about students of concern. We have a cross-departmental committee on campus that meets regularly to review reports in about students who are particularly struggling. So that could be someone in a dorm that their roommate has observed either acting out or staying in their bed all day long and they're worried about them. They receive reports from parents sometimes, so parents can actually contact students of concern directly and say, hey, I'm worried, I haven't heard from my son for 2 months, he's not returning my calls, how's he doing? This committee is one that includes people from housing, from financial aid, from student health, from counseling, police, a number of areas, academics, and they'll share information as is available and basically figure out how concerned to be and what their intervention plan might be. The University Health Service that sits on that committee, we can't call them directly because of privacy laws that govern our services, but we can be consulted with. And so when we hear from parents who are really worried about their kids, we say contact them directly, and then we will work with that committee to make sure that your student is supported. Another piece, I wanted to share with you a couple of numbers that we have. So for 24 hours for counseling, the number there is 855-817-5667. And then for medical is 800-681-4065. Oh, we'll put them on your Facebook page. I see a question. It says, a question about Let's Talk counseling support. What is that? So Let's Talk is a term that our counselors use for a drop-in model that is completely confidential, that is rather casual, I would say. It's all over campus where students can just drop in to talk about whatever concern they want without it being recorded or linked in their regular counseling records. So folks, for example, we have one over at Gender Equity Center who might have a concern they want to bring up, can just drop in and essentially start exploring whether counseling would be right for them and what services might be best to connect with. I'm seeing a question about outside insurance. Right, so this is a good one. Yes, we can see them. All of our core services are covered by the same copay. So primary care, urgent care, counseling. Primary care is $15, urgent care is $35 right now. Counseling is actually free to the students. All those services are equally open to all students. Now, if we start needing to do things like procedures or send them to the lab or the pharmacy, then the student is going to need to pay up front and then submit the receipt to their insurance, because at this time we're not able to bill outside insurances. We are working on that. That may change in the future, but for right now, that's the biggest limitation. That said, I have to say, in the time that I used to work as a clinician, what would happen is the student would get on the phone with their parents. Our prices are really cheap, and they'd say, hey, these labs cost $50. Shall I do it here, or should I go outside and get it done somewhere else? And usually the parents will say, you know what, it's probably better just to do it. So don't worry about it too much. Basically, if your student is sick, we will see them, and we will pay attention to what their insurance status is, and we'll try to advise them appropriately. Of course, we'll tell them what we think they need to do medically, but we do pause and say, hey, wait, maybe you should call your dad right now and talk about this. So, how many doctors are there or counselors? Okay, so that's a really good question. I can never keep track of them. I think, I hired most of them, so I should remember. I think there are about 20, 25 career primary and urgent care doctors and nurse practitioners working side by side, or 25 actually, the more I think about it, even 30. And then a whole number of per diems who come in and help out. We also have a number of specialists working. And then as far as counselors, we have more than 60 counselors of various trainings, so psychologists, social workers. I think we have some AFTs as well, family therapy working. And then we also have a number of trainees who work with us, postdoctoral trainees. So we're really constantly trying to maintain our capacity to meet the need of 40,000 students. It's never enough, but we're pretty good at trying. Yeah. What question? What can I do if I'm worried about my daughter? Oh, that's a good one. I have a teenage daughter, so I can very much relate to this. So the first part is you need to talk to your daughter and see how they're doing and try to connect with them. And I know that doesn't always work, but checking in with them is the most important part. You can call us and let us know your concern. So for example, you can call counseling and psychological services or psychiatry or medical, and we can take a report, but we won't generally reach out to the student directly unless we get consent from you, and likewise we cannot tell you anything about your student. They are at this point an independent adult in the language of privacy laws. So while we're very happy to give you general advice or help you out with some process questions, we're not going to be able to tell you anything about your child unless they give consent. And there are ways to do that, of course, both online and in person. The other thing, as I mentioned, was that if you really are worried, we do recommend that you contact students of concern. And that, I know we can maybe put that information too on the website, but it's also Googleable if you look for University of California, Berkeley, because they can reach out to students directly to check in and see how they're doing. Another thing that you can do is to make sure that you send medical records and such like in advance or even concurrently so that we have all the information that we need to take care of your student. I'm looking at some other questions here and concerns. There's a question about some special populations that might need additional assistance. So for example, I'm just going to go through a little list here. For students with disabilities, there are students with disabilities on campus, obviously both mental and physical health. There are students who are connected already with our Disabled Students Program, and there are some that may not yet be connected. We partner very closely with that program so that when they see somebody whom they think might need our assessment, they will refer that student to us. And ditto in return, if we are seeing somebody who we really think would benefit from their services, we will send a referral over and case manage together. We actually have a nurse case manager whose specific job is to coordinate the care between disabled student services and university health services. Another population is the LGBTQ population. We have a a very active transgender care program at University Health Services. We do a lot of work to make sure we meet people's needs and support them the best we can and help them navigate the campus. Likewise, some of our underserved populations, we have a special program for undocumented students. We have several special funding sources for students who need additional help. For example, students on Pell Grant who need a little extra help with their bills at the Tang Center. Let me see if I have any more questions. I don't think so. So I think what I'm going to do now is to pass this over to my colleague, Warren Whitfield, case coordinator for our Berkeley Student Health Insurance Plan. So he'll take over and talk a little and then take any questions. Thank you.
Hi, Cal parents. My name is Warren Whitfield. I am the insurance case coordinator for the University of California, Berkeley Student Health Insurance Plan. And what that essentially means is that when our students have issues with they need more care than just going to see a primary care, I help them navigate through the insurance process, whether it's referrals that they may need or bills that they've received that they don't know what to do with. I'm here to help them understand the difference between a copay and a coinsurance, what the deductible actually means. I help them learn the new language of insurance since they're relatively new to this world of ours, healthcare and health insurance. My other title at the university is the supervisor for billing and cashiering. The short of that is I make sure the bills get to the insurance company that we have so that we can receive the reimbursement for the services we provide for your students. I have been at the University of California, Berkeley for 4 years. My background takes me back to Cleveland, Ohio, where I was a supervisor for billing for University Hospital Health System. 7 hospitals, not a whole lot of patient contact, but I was drawn here back home to California, and I love the fact that I get to interact with our students here. So it's been a win-win for me coming back home, but just having to help your students navigate through the world of healthcare and health insurance. So I'm here to talk to you about our insurance and a little background that it's important for me that you know that the university is mandated to provide that the students come here as a non-academic requirement to be here. They have to have insurance, and we make everyone here get the student health insurance plan. So it's automatically you're enrolled unless with an option to waive out. In other words, when you sign up, when you get your classes, that fee is going to be assessed unless you successfully waive out of the insurance plan. The insurance SHIP is a comprehensive insurance plan that covers mental health, medical, dental, and vision. So it's a lot of services we provide for students that are new to the insurance so that they're covered fully while they're here at Cal Berkeley and even when they're away from Cal Berkeley, but we'll get to that in a second. I want you to also know that our medical is covered by Anthem, our dental is MetLife, and our vision services is VSP, as well as our mental health services is also covered by Anthem. So we have a good relationship with them. Their network is pretty vast around this area, so we have providers that we can send our students to. There's a couple of key dates I want you to keep in mind. Our insurance coverage dates start August 1st and they go through July 31st. So that's our whole academic school year for coverage. There is an annual waiver period of July 15th. And what that means is before July 15th, if you waive out of the insurance with your insurance that meets our criteria, then the student will be waived out for the entire school year. They don't have to try again in the spring. They are waived out for the entire school year. The waiver is made available online in the month of May. So we start sending out notices that hey students, hey parents, waive out now. If for some reason the students lose their coverage, parents lose their job, there's some kind of government mandate that changes the way things are covered now, the students can always get back on SHIP with a waiver reversal. So if you successfully waived out, but something happens where their coverage that you have for your student are no longer viable or that are ending, they can sign a waiver reversal to get back on the plan. Again, after July 15th, there's still a possibility for you to waive out, but there is a late fee of $75 that's assessed to your the student's CalCampus account if they successfully waive out. And that lasts between July 15th, it's a late waiver fee, July 15th through July 31st. Also, so, if you, for whatever reason, aren't successful in the fall, so you either missed the waiver deadline or your insurance didn't meet the criteria, you have an opportunity to waive out for the spring semester. That starts December 1st and goes through January 1st of the following year. So this year is December 1st, 2018 through January 1st, 2019. So that means they'll be waived out for the spring semester. Again, it's just for the spring semester. So they would still have to, when May comes around, in order to waive out for the following fall, they would have to do the waiver process again. And I will remind you that the waiver is an annual process. You have to do it every year. I know you may have the same insurance. We get those calls all the time, but we have to keep checking. So we put out every May that you have to waive out for the spring, but again, for the fall, but once you waive out, you're good for the entire school year. And remember, as Dr. Harte mentioned before, any student can use SHIP. I'm so sorry. Any student can use the TANG Center. They don't have to have a student health insurance plan. One of the other duties that I have is when I run into a student that needs additional help and they don't have the SHIP insurance, we get their insurance card. We will turn it over and find that customer service number and give it a call to see what they can do, what providers are in their area. It's part of what I do, and I'm happy to do it for your students, even when they're not on SHIP. So we help them, again, navigate the big world of insurance and understanding what it is their responsibilities are. We also offer preventative services. I want you to know for the student SHIP insurance plan, 100% is covered for preventative, $15 for primary care, as mentioned before, $35 for urgent care, and their co-insurance payment is only 10%. The insurance pays the 90%. If they go outside of our service center, the TANG Center, there is a $300 deductible, but not for inside the TANG. That deductible doesn't apply. Students, as you may know, also have access to emergency rooms and urgent care in case of an after-hour event or something that's more severe than we would normally handle. Those co-pays are $50 for the urgent care visit and $100 for the emergency room visit. So I want to talk about how we communicate to you, the parent, and mostly the students about our waiver process. We generally send out 3 emails throughout the course of the waiver period to remind the students that waiving out is the thing they need to do now. We send we post notices to Cal Central. We send postcards to where the student, their permanent address or their home address a few times a year during the waiver process so that they know that this is something they need to take care of before July 15th. We also have information on the UH SHIP website. That's uh.berkeley.edu is our website, where we also, again, in great detail, talk about the student health insurance plan and the waiver process. This process we're doing even here today with Cal Parents, we publicize through Cal Parents with their publications and certainly their social media. And we are on social media. We promote in every way possible that we can. Also through our student governments, ASUC, ASAO, and GA, and we do promotions through as much as we can through our Cal Day and Golden Bear orientation. So I have a question. If my son gets services at TANG and we need a bill for our insurance, how do we get that itemized bill? Great question. Anytime a student has services at Tang Center, they are to come to our cashier department. Once they make a payment, we would hand them what we call a walkout statement. The walkout statement has all the details that their insurance company is going to need. It has the procedure codes, the diagnosis codes. It has our tax ID information, the address, the provider of the services, everything that their insurance company is going to need for reimbursement. And again, I'm happy to walk them through what they need to do in order to get that reimbursement process started. It depends on their insurance based on how it will be covered, but we're happy to give them that information, and we hand every one of our students a walkout statement. Another question. My son is on SHIP, and I wonder if he needs to see a specialist. How does that happen? How does SHIP handle that coordination? In order to be seen, we have to have referral. We are a PPO plan, but we act an awful lot like an HMO. So in order to control costs, we make sure our students are being seen by our primary care doctor first before they go see a specialist. But once that's done, a referral is put in our system, and we forward that referral to Anthem. Once they have the referral, even before they have the actual referral, the student then has the permission to go see that specialist so they can get the care they need. If that specialist needs to see the student more often, the specialist can then request additional visits, which we're happy to grant. Again, the covered services we have for our students are to make sure that they have and get everything they need. Next question I have is, what is the cost for counseling? There's no charge for counseling. There's no limits to counseling. We do have a limit model where we're trying to help the students in a fashion where they can be moved to the community if necessary, but as long as they're coming to the Tang for counseling visits, there are no limitations or dollar amounts associated. So it's a free service that we are happy to offer the students who need a little extra help every now and then. What is the dental coverage? Great question. We have, I'm not exaggerating when I tell you, if you threw a rock, you could hit a dentist within a 100 mile, within a radius of a mile within Berkeley. There are lots of dentists here. They get 2 free cleanings every year. The limitation is $2,000. So if they have additional needs, like a filling that needs to be done, they can have that done as well. So it's just your basic dental services. It's really good, and again, it's what we do in order. Now, we don't have dentists on campus, and that disappoints a lot of our students. But again, we can walk down to Shattuck or Telegraph and find a dental office that'll take MetLife, and they're happy to help our students out. Last question. What if my student is traveling? We offer the Anthem coverage is year-round, and it's also worldwide. There's nowhere the student can't go that they won't be covered. They can be overseas. They can be across the states. They can be home in New Jersey or Ohio or Texas and still have the same robust coverage that they have here at the Tang. Again, this is a very, very robust plan that they have that helps them anywhere they are, anywhere they're going, and covers them 24/7, not just during school time. On behalf of Anna Harte and myself, I'd like to thank Cal Parents for inviting us here to talk to you about it. And please, if you have any questions about the insurance plan or coverage or anything, please call our office. The number is 510-642-5700. Thank you so much.